Good day, Kaalaga! My name is Leia, your future nurse. Today, I will demonstrate to you the preparation of doing sterile field, cupping, gowning, and gloving technique. The definition of doing sterile field: it is a microorganism-free area that can receive sterile supplies. Its purpose is to create non-contaminated area prior to sterile or invasive procedure. The equipments we needed are package containing sterile drape, sterile equipment as needed, wrapped sterile gauze, and antiseptic solution. While the definition of gowning technique: it is a robe or smock worn in operating rooms and other part of the hospitals as a guard against contamination. Its purpose is to prevent contamination to the surgical wound and help control infection via aseptic principles. And then the definition of gloving technique: it is a method where the sterile gloves are worn aseptically. Its purpose is to prevent any accidental contact any substance that could carry blood-borne pathogen with small breaks in the skin. The equipment we need are sterile gloves, which is appropriate in the size of your hands. Take note that we are going to do an open gloving technique. It is also performed when using sterile procedures such as bladder catheterization and insertion of an IV cup down when the gown is not worn. Extreme caution are necessary when using open method to prevent contamination by the exposed hands. Now, let's do the procedure. We need to complete all of the equipment such as packaging drape, surgical cap and face mask, gown, the sterile gloves, and a kidney basin just in case the doctor will wash a wound. Use proper body mechanism to prevent strain. But before that, make sure to check the client's order to know all the possible equipments that are needed. And then, explain clearly the procedure and its purpose to the patient as well as the relatives to gain their cooperation. And if the patient is unconscious, ask permission to the relatives. Next, get the surgical cap, put and securely tie it in your head to prevent transfer of microorganisms from your hair. Get the surgical face mask, and then remove all your jewelries in your hands to avoid possible tear when you are using sterile gloves and harbor microorganisms. Properly wash your hands and do scrubbing for infection control. Assume that I have a face mask. After washing your hands properly and did scrubbing, let's continue preparing the sterile field. Confirm the sterility of the package to ensure that it is clean and dry. Remember, moist indicates contamination, so if the package has it, it must be discarded. Select a clean work surface above waist level because below waist level is considered contaminated. To open the wrap package, place the drape package at the center work area so that the top flap of the wrapper package opens away from you to prevent subsequent reaching over the sterile contents because this could contaminate them. Pinch the wrapper's top flap between your thumb and index finger, touching only the outside wrapper because it maintains the sterility of the inside drape. Repeat the side flaps using your right hand for the right flap and using your left hand for the left flap. By using both hands, you avoid reaching over the sterile field. Pull the innermost flap or the fourth flap towards you, allowing it to fall flat on the surface. Make sure that the flaps does not touch your uniform. If the surface or the inner surface touch any unsterile particles like uniform, it is contaminated. Before we proceed completely in sterile drape, we should do gowning technique. With one hand, pick up the entire folded gown from the wrapper by grasping the gown through all layers. Be careful to touch only the inside top layer that is exposed. Once your hands are securely pitching the gown, Allow it to drop. Make sure that the gown does not touch any unsterile objects in your surroundings. Grasp the inside shoulder seams and open the gown with armholes facing you. Carefully insert your arm partways into the gown one at a time, keeping your hands at shoulder level away from the body. A feather assistant will help you fasten the belt behind you, positioning it over the shoulders by grasping the surface inside of the gown at the shoulder seam. The feather assistant's hand should only ever be in the surface inside of the gown. There is a two tie in front of your gown attached to it. Hold the left tie and the right tie, pass it to the assistant, ensuring do not make direct contact with their hands. The feather assistant will tie and make a knot of the gown to secure it. After the gowning technique, we will proceed to gloving technique. Remove the outer wrapper by separating and peeling apart sides. Lay it on a clean, flat surface to prevent inner glove package from accidentally opening and touching the contaminated objects. Open the inner wrapper, touching only the outside. Secure both flaps. Remember, the outer portion of the inner wrapper is contaminated while the inner portion of the inner wrapper is sterile. Identify the right and left glove. Each glove has cuff approximately 5 cm and 2 inches wide glove in a dominant hand. Use proper identification of gloves because it can be contaminated by improper fit. Gloving dominant hand first promotes efficiency. With thumb and the 2 first fingers of non-dominant hand, grasp the inner fold of the cuff. Lift the glove, hold it away from the body. Slip the dominant hand, touching only the inside surface. Touching only the inner side surface of the glove, then vice versa. Remember, a contact glove hands with exposed hands leads into contamination. Adjust the fingers by the gloved hands. If one sterile object touches the second sterile object, both remain sterile. And always remember, raise your gloved hands above waist level because below waist level is considered contaminated. Then the next one, grip the inside wrapper using your thumb and index finger. The inside wrapper is sterile and drop it. Do not use your body to drop the wrapper because it can be contaminated. After gowning and gloving technique, we can now proceed in completing the sterile field. Remember, only this part is sterile while both sides has an sterile part. So we will use these small sterile drapes to cover them. Carefully open it and flap it without touching any unsterile object. Then, the other part. Open it carefully and flap it without touching any unsterile object. Now, we have a big sterile drape. We can use this to cover the drapes, securing them. To add sterile item on a sterile field, open the outer wrapper while holding a non-dominant hand to free the dominant hand to unwrap the outer package. Peel it carefully. In dominant hands, place items well within the sterile field. Small sterile items such as gauze dressing should be dropped 6 to 8 inches above the sterile field, while the large sterile items should be put down carefully to prevent contamination on the sterile field, and then dispose the outer wrapper. Then, to add liquid solution to a sterile field, read the solution label and strength 3 times to ensure giving the right medication. Remove the lid and place the sterile side up onto a clean surface to prevent contamination of the lid. Holding the bottle, pour the liquid from 6 to 8 inches above the sterile container in the sterile field to avoid the possibility of 2 containers touching each other. Pour slowly to prevent splashing. Remember, if liquid is spilled in sterile field, the spot is already contaminated. So keep your arm as far as possible from the sterile field and avoid reaching over the sterile field to prevent contamination of sterile area. After cleaning the wounds, let's proceed in removing the gown, gloves, surgical cap, surgical face mask, and the sterile field. The gloves is always removed before the gown to prevent cross-contamination on the wearer's scrubbed attire. In removing gloves, clasp the soiled gloves under the cuff of the left glove, using the thumb and fingers of the right hand. Slip it off and then vice versa. Discard the soiled gloves in an appropriate receptacle. Moving the gown, grasp the shoulders gown. Pulls it off downward from the shoulders of the arm. Turn the sleeves inside and out. Folds the contaminated surface of the gown on the inside and rolls it away from the body. Discards the rolled gown in an appropriate receptacle. Put away your mask and discard it in an appropriate receptacle. And then loosen the surgical cap discard it in the appropriate receptacle. Then wash your hands with soap and water and use alcohol for infection control. In cleaning the sterile field, you should have face mask, surgical cap, and then gloves. If the container has fluid residue, place the liquid in an appropriate receptacle and then the sterile drapes. Roll it forward . Roll it forward at the center Remember first to remove all the instruments before you put the soiled drapes into the hamper. And now, remove your gloves. Discard the gloves in an appropriate receptacle. Remove the face mask and the surgical cap. Now, wash again your hands properly with soap and water. Document any unusual observed during the procedure and evaluate the other needs of the client. I hope I clearly present to you the process. Once again, Kaalaga, your future nurse, love, Leia.
Thank you.